Hey all, so this is a short podcast to follow up on the uh, ultrasound that I posted yesterday on Friday, January 21st. So as you can see, this is an ultrasound done with a curvilinear probe. You can tell by looking up here at the top here. And it's an ultrasound of the right abdomen. And it is liver and kidney, and we're obviously doing a fast exam looking for any fluid. And as you go through this, play it again here, you can see right here, this is the inferior tip of the liver, which you want to make sure that you cover in every fast exam. So it's really important to visualize this paracolic gutter here at the caudal tip of the liver and the inferior portion of the kidney. And I'll go over that a little bit more when I start drawing. And you can see what looks like, oops, I can't catch it. I have a still picture of it, which I'll show here in a second. But you can see some dark fluid down here. Move this out of the way, right in this area. And that's most likely gallbladder. You can see a wall around it, which tells you that it's, and a very regular shape to it, which tells you it's within a cavity or an organ, in this case, most likely the gallbladder. So you can see here in this still image that the area that I was talking about right here, you can see this thick wall around it, which tells you it's not a collection of blood or fluid. It's actually enclosed in something, and that something is most likely the gallbladder. This is liver, of course. This is diaphragm. And as one of my esteemed colleagues, Katie Hornbacher, posted, and she's entirely right, this is, you can't see the spine, which would be down here. And I'll pull up another video on that and get that down. And there's no spine sign. Spine sign would mean if there's the spine extending this way. And if you're able to see that, there's got to be something transmitting, and most likely it's fluid in the pleural space. This is just what they call a mirror image, and that's normal. It's a mirror image of the liver, and that tells you there's not any fluid in the pleural space or down here. And you can see on this still image, this is the kidney here. If I can keep my pen writing. And this is the interface between the kidney and the liver right here. And this is part of Morrison's pouch. And this is the paracolic gutter right here. This is the caudal point of the liver and the inferior portion of the kidney right here. And it's really important that you look in this spot whenever you fast exam, because it's really easy just to visualize part of it. And a lot of times this is where the fluid will first start accumulating. So this here is a collection of fluid, whether it's blood or whatever, depending on the scenario of the patient. But this means that it is a positive fast exam, positive for fluid in the abdomen. And you can see down here, this is the spine, and the diaphragm is going to be over in this area, which I'm going to pull up another still here in a second and go over it. But you can see the spine, and you should see it all the way up to where the diaphragm meets, but then you should not see it past here. In this view, you can see the spine that I was talking about before coming all the way along here, and that's normal, and you should be able to. But this is the diaphragm here, and you notice that you can't visualize the spine going this way. And again, as I briefly mentioned before, that's a normal thing. This is mirror sign of the liver, which is good. If you could see the spine, then that would be an indication of fluid in there, and most likely this would also be an anechoic collection in here. You'd see black in there. So I hope this podcast was helpful, and I'll have some more coming out soon. If you like it, give me a thumbs up, and I appreciate it. Have a great day.